The challenges we're facing in Kensington are huge. We're facing an epidemic in Philadelphia that I don't think any of us have seen in our careers, and I'm not quite sure our fathers or grandfathers saw an epidemic like this in their careers. Part of the Resilience Project was really about thinking differently, working differently, pairing up teams in ways that haven't been done in the past. And I'm very happy to be here today to announce one of those innovations between the fire department and behavioral health. The work that we've done here, the resources that we put into Kensington, the challenges we're still faced, and the commitment we still have to these challenges wouldn't be made possible without our mayor. This is the only administration I've seen in my tenure or my time in Philadelphia that has put a stake in the ground and made a long-term commitment to this community. Everything he does is about equity and opportunity. The Resilience Project is no different. It's about how do we solve the challenges, not today and not tomorrow, but in 10 years. What can we do today to make things better for our future? And so it's my pleasure to be here today. Thank you all for being here, and I will turn it over to Mayor Kenny.
Thanks. Good morning, everyone. It's great to be here alongside our hardworking first responders, health department, and behavioral health officials to announce this innovative program that will support the Philadelphia Resilience Project. Through a grant-funded partnership between the Philadelphia Fire Department and the Department of Behavioral Health and Intellectual Disability and the Health Department, we have launched an alternative response unit known as AR2. In an effort to increase warm handoffs, a paramedic and a case manager will respond to calls of overdoses in a fire department SUV, as you see behind us, which can provide outreach, education, and connect patients who are ready for treatment with an available spot in a facility. Their response to each call varies with the specific needs of the patient. It's about meeting people where they are. If a patient is not ready to enter a treatment facility, AR2 will offer free naloxone and information on how to access care when they are ready. This unique combination of responders is positioned both to reverse opioid overdoses and immediately connect patients with treatment options and transportation. AR2 was piloted in April and successfully engaged 25 people in the first 6 weeks. 6 clients accepted treatment, and many others accepted naloxone and linkage to care information. I'm pleased to hear that these results, and ensure that this initiative will develop trust between residents, first responders, and the city, and remove barriers to treatment. And I'm proud to highlight the incredible work that city departments and agencies, our partners, community organizations, and residents have done through Philadelphia Resilience Project. In addition to the creation of AR2 through the Resilience Project, we successfully closed 3 major encampments, provided housing and treatment options for those struggling with substance abuse disorders, created safe corridors for our school children to walk to and from school, and beautified neighborhoods through cleanups and community art projects. And there's people out on Kensington Avenue now continuing to clean up. There is still much more that needs to be done, but we are on the right path, and this new program will help us save more lives. Next month, we will report out on the progress we've made since the activation of this project, and we look forward to sharing all of our accomplishments and next steps to expand the Resilience Project citywide. And at this time, I'd like to introduce Adam Keel as our great fire commissioner to give you more information.
Thank you. Good morning, and thank you all for joining us. The Philadelphia Fire Department, as you know, is one of the busiest fire departments in the entire nation. And you can hear that as we continue to go through this press conference. We do about 1,000 EMS runs every day, 1,000 EMS incidents every day, 24/7, 365. And again, you can hear that. Some percentage of those are overdose-related incidents. And as you heard the managing director and the mayor talk about, this is a crisis that is almost unprecedented in its scope and its breadth. The numbers, however, don't tell the whole story. We can measure a lot of things. We can measure response times. We can measure cases. We can measure administrations of Narcan and other life-saving medications. What we can't measure, and the true keystone of this program, is caring and compassion. the caring and compassion that's delivered by our members, the almost 3,000 men and women of the Philadelphia Fire Department, 24/7, 365. And more importantly, as represented in this novel, and we believe first of its kind in the nation, this multidisciplinary partnership with other agencies and with members of those agencies whose dedication and service we have seen already in a short time match our own. See, I've said for the past 3 years that the dedication and service of our Philadelphia Fire Department members is without peer. And now I've learned that this team of social workers and case managers and epidemiologists, physicians, paramedics, absolutely incredible. The work they've done already, even during our soft rollout, the numbers just can't tell the whole story. And it is appropriate that in this city of firsts, that we believe we are the first to roll out this kind of caring, compassionate service. You see, if there's one thing I've also learned about Philadelphia, it's that we never give up. We never give up on our sports teams, and most of all, we never give up on our residents. We never give up on people. We work till the work is done. And we know that in this case, we have miles to go. And I am so proud that this idea, supported by our mayor, our council, our managing director, our first deputy managing director, the entire Resilience Project, and executed in the street 24/7 by our members and partners, I'm almost without words. So thank you all for being here. God bless the city of Philadelphia. And thank you to all the men and women you see behind me, because they're the ones who are actually doing this work.
Hello, everybody. My name is Crystal Yates. I'm the Assistant Deputy Commissioner of EMS for the Fire Department. I'm honored to be here with Mayor Kenny, Commissioner Teal, and all of our partners to talk about AR2. AR2 is important, and this is an exciting day for us. One of the things that I recall hearing from our field medic providers is that they felt like they weren't doing enough. They were taking people with substance abuse disorder who overdosed to the hospital, and then they would see that same person again maybe later that day or the next day. They felt like they weren't making a difference. All they can do is go to the hospital, and that's it. We brainstormed, my team and I, in behavioral health and public health, and came up with this idea. Wouldn't it be great if we got the experts in EMS and the experts in behavioral health and public health to get people into treatment? So it took us some time, but we did it. We applied for a grant 2 years ago. We didn't get it, but the mayor and his administration felt that it was an important idea, so the city put funding into the project. Public Health reapplied for the grant. They got the grant, which was great, which allowed us to expand the services to 7 days. And now, 7 days a week, we have a paramedic lieutenant, a case manager, a social worker roaming the streets of this catchment area trying to connect people to service. And like the commissioner says, the numbers can't really say it all. We've had 2 people just walk up to the unit to ask for help. We've had the unit follow one person to the hospital and try to see that they got help. The person was placed into the triage area and really wanted to leave the hospital. AR2 engaged them. That person agreed to accept treatment, wanted to accept treatment, and they spent an entire day and they successfully got that person into treatment. So I think this is a great day. It's a great unit. The members are here. I thank them almost every day when I see them, and they'll be here. We'll give you guys time to explore the truck and talk to the members, but thanks for being here.
We think the alternative response concept has value not just for changing the way we respond to emergency incidents, but giving us that ability to be proactive and extend care in advance. You know, there are some things that are happening at the federal level and also at the state level that we hope are going to provide us some opportunities to give that care in a different way. So heretofore, our options have been fairly limited. Somebody calls 911, we take them to the hospital. Now we hope this, and again, you heard a couple of these case studies already, now potentially we're able to, even if we take folks to the hospital, we're not doing it in an ambulance, which is a very scarce resource here in the city, a very in-demand resource here in the city. And again, we're fortunate that in the mayor's proposed fiscal year 2020 budget, we have another 5 peak time ambulances in that budget. We know that as our demand continues to increase, that's still going to be a scarce resource. So we have great hopes for this concept, and again, it builds on the work that we were able to pilot with Penn. And we have big plans for alternative response. I think we're already seeing, I would say the concept has been proven, and now it's simply a matter of leveraging some of these other opportunities, looking at some other patient cohorts, and try to find some innovative ways to fund these critical core services to our communities. All of our alternative response units respond with the full regular complement of response assets required by that incident. So that typically, frequently asked question we get, I call 911 for an ambulance, why did you send a fire engine? Because we have more fire engines and ladder trucks than we have ambulances. All of those fire engines and ladder trucks are also part of our emergency medical services system. They're all staffed by firefighter EMTs. They all have Narcan. So the first thing we send is the closest available resource, along with the closest available transport unit or ambulance, and then the alternative response unit arrives to maybe be able to, the idea is that they can, if it's the type of case they can handle, then they can release those other emergency response assets back into the system so they're available for the next call. And then the other thing you heard, again, is that they can track people through the system in a different way. They literally, you heard this one case, to expand on it, our folks, again, they're so determined, they're so dedicated, they weren't going to give up on this patient. So they tracked them down on the other side of their hospital admission and got them to agree to go into treatment. And that's the that is literally the kind of thing that we're trying to do. So this isn't just about calibrating our response assets in a different way. It really is about completely rethinking the kind of care we provide. And I would suggest to you that, again, this is the first in its nation. There's a lot of other things and different ways that we need to think about delivering emergency medical services, and not just as it relates to overdoses, but everything else that we do. And rest assured, we're doing that, again, with great support from the mayor, managing director, and the entire Resilience Project partnership.